Brad Conder again. Just wanted to talk a little bit today about sciatic nerve and what it is. There's a lot of confusion sometimes about the sciatic nerve, primarily because a lot of people use it in kind of a garbage can type way. And I don't mean to say that as to lessen the severity of what it is. What I mean to say is that a lot of times people will have back pain and leg pain and lump it all into one category. And it can be actually very, very different. The sciatic nerve, truly what it is when your nerves come out of your spine and into your hip and form one big nerve that goes down your leg. And you can get different parts of the sciatic nerve that are irritated. Oftentimes the source truly is your back. So you get one nerve in your back that's actually giving you the problems that you're experiencing. And so I wanted to show you that a little bit on a model that I have. So this right here, if you can see it, is a skeletal model, and this right here is a sciatic nerve, right here. So as you can see, when it comes out, it branches out and it goes all different types of places, but really how the nerve comes out of your spine in this area from different levels of your spine. And what can happen when you have a sciatic nerve problem is you get some type of pinch up in your spine, like at your joints or at your discs. So what we're dealing with here is more of some type of nerve pinch in your back typically. A true sciatica is when your muscles in your hip are really, really tight, causing you shooting pain down the back of your leg. Now that can happen as well, but the key to it is you don't want to miss what's happening at your spine. Oftentimes I get people to come in, they only have like a pain down the back of your leg and no back pain at all. They actually wonder why I'm working on their back as well. It's just all part of the chain. So when you do get treatment for the sciatic nerve, you want to make sure that you're treating the back and the hip at the same time. We don't want to get too caught up in the details as far as sciatic nerve problems and what it actually is, because you might miss the boat as far as the overall treatment, which would be more flexibility, more range of motion, more core and hip strength that's actually going to support some of these changes that may have happened as far as trauma, degenerative disc bulges. We want to be able to support all those things by getting your body working better, and that's what's most important. So sciatic nerve, just to kind of recap, it is a part of it is a nerve symptom. You're going to feel burning, shooting pain. It's very, very painful. It can be different from just mechanical back pain, even though mechanical back pain can cause sciatic nerve problems. And one tip I wanted to kind of give you today is to make sure to ice your back, because a lot of times people don't like ice, but the anti-inflammatory effects that it have is very greatly underused, and we need to use that natural way to get some anti-inflammatory effect. And you want to do your back, you can do your hip as well, or do both at the same time. It's really going to give you some good benefit. So make sure that you're doing these self-treatment options. If you have more questions about if you have sciatic nerve problems and need some treatment, let me know. I'll be more than happy to help. Thanks a lot.